my name is Elizabeth, and I'm an occupational therapy assistant student at Bryan and Stratton College in Wauwatosa, Wisconsin. Today I will be going over techniques on how to manage and control your breathing if you're an individual who experiences stress or anxiety on any level. This video is designed to target the parasympathetic nervous system in your body to help regulate heart rate and understand feelings of nervousness, restlessness, or tension that often surface with stress and/or anxiety. These exercises can be beneficial for individuals who experience any levels of stress and anxiety, have a difficult time making decisions, have difficulty falling asleep or concentrating, or individuals who have increased heart rate or rapid breathing patterns such as hyperventilation. This video is targeted to help individuals who may have a diagnosis of PTSD, depression, anxiety, OCD, and/or ADD or ADHD, but can be beneficial for anyone who is looking to control their stress levels through breath work. Before we get started, it's important to note that if you experience any increase in shortness of breath or dizziness, to stop these exercises and assess your health first. These exercises are designed to be performed in a seated position and in a safe environment to you. Finding a space that is safe and comfortable is important, and you may even trust yourself to close your eyes while you complete these exercises to help focus. Set up your environment for success first. Turn down the lights, decrease as much surrounding noise as you can, and find a place that you can sit or lie down with ease. Controlling the environment is only one step towards managing stress and anxiety, and anyone can do it. Some materials you may need is a surface to sit comfortably on, such as a chair, your bed, or grabbing props like a pillow or a blanket. Feel free to pause this video at any time to grab props or take a break, and let's get started. Breathing exercises can help you relax because they make your body feel like it does when you are in a relaxed state. Deep breathing is one of the best ways to lower stress in the body because when you breathe deeply, it sends a message to your brain to calm down and relax its response to internal or external stressors. Deep breathing also increases the supply of oxygen to your brain and stimulates the parasympathetic nervous system, which promotes a state of calmness. Studies indicate that abdominal breathing for 20 to 30 minutes each day can reduce anxiety and stress. I will talk about belly breathing in the second exercise of this video. Our bodies are composed of three autonomic nervous systems. An autonomic nervous system is a part of our body that responds to stimuli automatically without our brains breaking it down into a decision-making process. The parasympathetic nervous system is one of the three divisions of the autonomic nervous system. Sometimes called the rest and digest system, the parasympathetic system conserves energy as it slows down heart rate, increases digestive activity, and relaxes specific muscles along the intestinal tract. When our bodies experience stress, the parasympathetic nervous system comes to the rescue to help bring us back to a natural, healthy state. Practicing breathing exercises helps activate this response quicker and more efficiently. There are many other benefits of breathing in addition to relief of stress and anxiety, including increasing a feeling of calmness, relieving pain both emotionally and physically, stimulating the lymphatic system which aids in detoxifying the body, improving immunity, increasing energy levels, lowering blood pressure, improving digestion, and helping to support correct posture. I will go over correct posture while completing breath work in each exercise, but it's important to note that if any of the postural cues I provide do not work for your body, it's okay to modify or adapt to make yourself comfortable and safe. Doing these exercises first thing when you get up in the morning can also relieve muscle stiffness and clear clogged breathing passages. Using these techniques throughout the day can also help manage stress and anxiety levels, and the more you practice them, the more mindful your body will become of its internal state. Before we get started, let's review the anatomy of the body and the organs that help you breathe. The diaphragm is a flat muscle that rests between the ribcage and the stomach. Using the diaphragm in breathing exercises can help improve core muscle stability and can also improve your body's ability to tolerate increased activity. Utilizing this muscle can also lower your chances of injury or wearing out the surrounding muscles. Specifically, it slows your rate of breathing so that you can expend less energy. Typically, when we think about breathing, our lungs are the first organ that come to mind. The lungs expand and contract with every inhale and exhale and are also responsible for the exchange of oxygen and carbon dioxide. Utilizing and targeting the lungs or rib cage with breathing can help you relax by lowering the harmful effects of the stress hormone cortisol in your body. It lowers your heart rate and helps lower your blood pressure. It's important to think about chest breathing in a 360-degree plane. When we inhale, our chest or front of the body is not the only side that inflates. Our back rib cage can also expand, and you may even be able to feel your shoulder blades begin to lift. Lastly, our stomach. It may seem odd to think about the belly and its role in breath work, but have you ever noticed an increase in difficulty breathing while laying on your stomach? Removing the stomach in the flow of breath can actually decrease the amount of air your body takes in. Why? Think about how your body is designed. When you breathe in, your lungs expand and your diaphragm gets pushed down to create an extra room for the expansion. But what does the diaphragm push down into? The stomach. Often called belly breath, abdominal breathing increases the supply of oxygen and nutrients to cells throughout the body. It can relax muscle spasms often experienced during panic attacks and hyperventilation, and reduces muscular tension that eventually may cause structural problems. Each part of our body plays a part in breath, and it's important to remember that structured breathing exercises can take practice, even though it's an automatic response from our body to breathe on its own naturally. Let's begin by exploring ways of controlling the breath under extreme stress, and we can find and put together the pieces as we go along. This first exercise is designed to help you manage your breath if you're already experiencing rapid breathing or heart rate such as hyperventilation or even having a panic attack. It's important to first identify that you're having difficulty breathing and position yourself somewhere quiet and safe where you can focus on your airflow. Find yourself in a seated position with your spine tall and your arms overhead. This will allow your front body, including your heart and rib cage, to open up and allow more oxygen to your lungs and brain. Next, close your lips and try to take in as much air as you can through your nose. When you feel like you can't inhale any longer, take a big sigh out of your mouth. Repeat this technique again, focusing on the rise and fall of your chest. If your mind starts to wander or continues to race, try counting the amount of time it takes to breathe in and out and see if you can reach 4 seconds. Once your breath starts to feel typical again, you can continue to breathe the way that it's most comfortable to you. Let's review. This first breath is often used with individuals who experience hyperventilation or increase in rapid breath or increase in heart rate, often associated with panic attacks or stress and anxiety. It's first important to identify that you're having difficulty breathing and know that you need to use these breathing techniques to help regulate your heart rate back to a normal level. Find a nice seated position and make sure your spine is tall and your arms are overhead if accessible to really open up the front side of your body. Always remember to take the inhale through the nose and the exhale through the mouth. This regulates the flow and the direction of your breath and oxygen through your body, allowing more air to get to your brain and to your lungs, decreasing the stress in your body. And as always, if you need a little extra concentration, try counting to 4 seconds. This second exercise is a long, lofty, deep 3-part breath. It is designed to calm the mind and enhances feelings of introversion and perspective. This breath allows for complete exchange of air in the lungs and helps to oxygenate the blood. It is also known for its abilities to release tension in the chest and abdomen. It's important to remember to never hold your breath during this three-part exchange, but instead, think of it as a continuous flow of energy through the body. To begin, sit with your spine long and place your palms on the belly and breathe into your lower lungs. Feel the diaphragm drop and the belly expand into your hands. Take a moment here and take a few breaths to really feel. Next, shift your palms to the sides of your rib cage and breathe into your chest, feeling the rib cage expand out to the sides like a balloon filling with air. Once again, take a few breaths here to feel that expansion into the middle of your body. Start to place your fingertips on the front of your chest just below your collarbones. Breathe into the upper part of your chest and feel your hands lifting. Again, take a few breaths here to feel the expansion of your heart pushing outwards and your hands lifting off the top of your chest. Once you are ready to connect all three parts, place one hand on your belly and the other on your chest below the collarbones. Begin by letting all the air out of your body with an exhale. With your next inhalation, start with the belly breath. On the same inhalation, move your breath to the sides of your ribcage and up into the top of your chest. When you feel full and are ready to exhale, softly release in the opposite direction: chest, ribs, belly. It may be easier to focus on the rise and fall of your hands instead of the parts of your body lifting and relaxing as well. Just as before, counting the breath in your head can also help the flow of oxygen in this breath. Try a few on your own. Let's review breath number 2. This is a three-part breath, meaning that there are three parts of the body to focus on. Every inhale, start with expanding through the stomach, the ribs, and then the chest. Once you're ready to exhale and your body feels full, go in the opposite direction, releasing from the top of your chest, down to the ribs, into the stomach. Placing your hands on your stomach and your chest can help focus on these areas as you imagine your hands rising in opposite directions. You can also count 3, 2, 1, or 1, 2, 3 to take your mind off the actual part of the body and focus more on the energy and the direction of the flow. I hope these two breathing techniques have been useful for you. Another useful tool, if it's available to you, is to track your oxygen level and pulse rate using a pulse oximeter according to the parameters provided by your treating physician. It's a simple tool that slides on your finger and reads how fast your heart is beating and how much oxygen is circulating in your body. If you have any questions or concerns, you can leave a comment below or consult with your treating physician or therapist. We would appreciate your feedback regarding implementation of this video. Please take a few minutes to complete the brief survey using the provided link below. Thank you, and I look forward to seeing you again soon.